Papua New Guinea is known as the Pearl of the Pacific. It shares borders with Indonesia and Australia. Like many other developing countries, Papua New Guinea is faced with the challenge of a growing epidemic of HIV.
It entered Papua New Guinea in 1987 and from there on spread very vastly throughout the country.
Papua New Guinea has the highest rate of HIV in the Pacific. 99% of all HIV cases in the Pacific are in Papua New Guinea. This documentary covers the response of the Catholic Church to the HIV epidemic in Papua New Guinea. HIV spread very rapidly throughout the country. The main method of transmission is through sexual intercourse. The Catholic Church started to focus attention on HIV from the year 2000. By 2004, a generalised HIV epidemic was declared in Papua New Guinea. Also in 2004, the Catholic Bishops' Conference created an office for HIV and AIDS. From a small start with only 2 or 3 people, the Catholic Church's efforts have grown, with bases now in various locations around the nation. The AusAid-funded Church Partnership Program has enabled the placement of a full-time coordinator in each diocese.
National office, which is run by Sister Tarsisia in Port Moresby, and her staff, is a very great support for all of the dioceses and the diocesan programs, HIV/AIDS programs.
For the Catholic Church, voluntary counselling and testing, or VCT, is a major part of its prevention strategy. For this reason, the Church has been opening counselling and testing sites throughout the country.
Beautiful Madang has a problem. And beautiful Madang, as it is, has quite a major problem with HIV/AIDS. And this opening today is a response to this problem, a response of the Church to support and care for people infected and affected by the HIV/AIDS crisis.
The Catholic Church's first VCT centre was opened in Madang in 2005. In that year, the Church also started testing in other places. In 2005, around 6,000 tests were done in church centres in Papua New Guinea. 5 years later, in 2010, close to 50,000 counselling and testing sessions were undertaken, indicating a major increase of services offered to people wanting to find out their HIV status.
Testing is becoming more and more something that is very common in the eyes of the people, and so more and more people feel comfortable to come for testing. We have a lot of people that walk in voluntarily to our care centers where testing is available throughout the day. And when we do go out to outreach into villages, we have very large crowds that come for the overall awareness, which is given first of all, and then as testing is offered, many people also come for the testing.
VCT, or voluntary counselling and testing, caters for people who'd like to know their HIV status. Pre- and post-test counselling helps to inform individuals or groups about the disease, how to minimise the risk of infection, and how to live positively with HIV if found positive. At present, the Catholic Church has over 100 testing sites across Papua New Guinea. Monthly reports from these centres enable the National Catholic AIDS Office to monitor the workload of staff members, assess the needs in each location, and distribute the necessary resources. The office distributes antiretroviral therapy drugs and other medical supplies to the various centres throughout Papua New Guinea. As the Highlands region is more affected by HIV than some of the coastal regions, the Catholic Church has concentrated effort in the Highlands region. This has included the establishment of VCT services, training centres and also treatment centres. Mendi is located in Southern Highlands Province. This large province has more than 600,000 people. Major resource projects and economic development have meant that HIV has been spread through sexual promiscuity by people with money to spend. VCT services commenced in the province in 2005. A dedicated centre was built in 2006. The centre is named Ipianda, which means good house in the local language.
It wasn't named at the beginning. It was called a care centre. But then the people around here said, Ipianda, this is a good house. This helps us.
There are now 7 locations in Southern Highlands Province where the Catholic Church offers testing services. Testing is integrated into health facilities. Trained nurses conduct counselling, testing, reporting and treatment of people living with HIV.
All our Catholic nurses are trained on HIV. Everyone is trained. And those people who are coming new to the diocese, we introduce HIV/AIDS training programs first.
Western Highlands Province is a great concern for the National Catholic AIDS Office due to the high number of people who are HIV positive. The Church has changed the location of the health centre in Mount Hagen in order to use the old urban clinic as a treatment centre for people with HIV. There are more than 1,800 people enrolled in the Rebiamal Treatment Centre alone. This number is growing every month. There are 30 to 40 new cases of HIV-positive people registered at Rebiamal each month. A great concern is the spread of the virus to remote areas. There are HIV-positive pregnant women in remote parts of the Jimmy Valley. It's very difficult to provide treatment and care and to assist with the prevention of mother-to-child transmission in such remote localities. To reach remote places, staff members travel out to different parishes. They also visit schools and prisons.
As a team working here and doing this program, we feel very competent because our team is composed by voluntary counselors working in Rebiamal Clinic and also nurses working in ART Clinic. In the communities where we offered awareness, information and education, we already could notice some changes. People really became more aware of the danger and the risk if they don't change the behavior. The same we noticed in the school. Many students, through the questions, discussion, informations, they are more aware of their sexuality and the responsibility. The people infected by HIV/AIDS virus is given the possibility, through this counseling and testing, is given the possibility to be treated. And the people who are healthy is given the chance to understand and to change the behavior. And very often we can notice really the change that is coming through this awareness.
A pioneer centre in the Highlands region was established in Barnes in Jiwaka Province by Sister Rose Bernard. Work has included voluntary counselling and testing, outreach, home visits and caring for people who are HIV positive.
My priority, as I could see it, would be Shalom Care Center, looking after the people who have the virus. This is where I felt a great need. I see them in the villages suffering and afraid and worried, and they're dying quickly. And so I felt there was a great need to help in that area.
Shalom Center has been very special and been advertised around the world, the way Sister Rose Bernard cared and carried out her work with the HIV/AIDS positive people.
In addition to caring for people living with HIV, the Shalom Centre in Barnes also offers voluntary counselling and testing. Typically, people seek VCT in order to determine their HIV status.
And even if the person is tested negative, that is a tremendous chance for prevention. They've gone through the trauma of knowing that it could be positive. And when they found out they're relieved now that they're not, then we talk about how can you keep being negative. And that's and I see some people who have gone through that trauma, they've changed their lifestyle just because of that. And so I think it's a tremendous way.
On many occasions, couples go to the VCT centre together in order to be tested. They want to be tested before they get married. Or, if a couple has been separated for some time, they want to get tested before they get back together again. The ensuing discussion of sexual behaviour can lead to HIV prevention. Couples counselling also provides a chance to address gender violence.